skyrocketing. In New York, more than 3,000 more cases in 24 hours, most in New York City. And what the health commissioner revealed in New York today. The major new restrictions in California, a statewide stay-at-home order for 40 million, and the sobering prediction there tonight. The president is asked about a nationwide shutdown, what he's now saying. And we hear from patients with coronavirus across this country tonight, their symptoms. And the news tonight involving the breakdown of the virus, men versus women, and what could be driving it. Tonight, the president now confirming he has invoked the Korean War-era Defense Production Act, which allows the president to ask private industry to start making ventilators, masks, medical supplies. Has he made that request? How he answered today. The hospitals and their pleas for help tonight, running out of supplies, ventilators, and ER doctor in protective gear, testing positive. The president tonight and what he said about a possible drug that he said could be a game changer to treat the virus. And then the nation's top doctor in infectious diseases is asked about it. Dr. Anthony Fauci, reality check. The stern warning from the World Health Organization tonight for young people. Nearly 40% of those hospitalized here in the U.S. are between 20 and 54. The staggering new number in Italy tonight, the worst yet. Inside the hospital at the epicenter of the hot zone, and you will see tonight what it could tell us about what doctors could very well soon see here. And at least 2 senators under fire tonight for selling stock right before the coronavirus pandemic. One of them privately warning others about what could be coming. That senator is pressed tonight.
This is ABC World News Tonight with David Muir.
Good evening, and it's great to have you with us here on this Friday night, and we have made it through another week together, a truly historic week. This is something we have not seen in modern times. Life in this country really changing in unimaginable ways, very likely for several weeks, if not months to come. Tonight, the number of cases of the coronavirus has now soared past 17,000, one-third of those cases here in New York City. At least 200 dead. Again, they think this is much higher. The number of cases in this country, of course, the testing still catching up and will likely reflect that number. Tonight, President Trump saying, quote, "We will win this war," confirming he has invoked that Korean War-era law that allows the president to ask manufacturers to produce needed medical supplies. But has he asked for those supplies to be made? What he's saying tonight. The president is also asked about the potential for a nationwide lockdown, and you'll hear what the president said about that. The U.S. tonight tightening the border, imposing new restrictions on non-essential travel between the U.S. and Mexico. Of course, those restrictions already in place with Canada. And states taking extraordinary action in this country. First, California's governor ordering the state's 40 million people to stay home. And we saw those images, highways empty today. Tonight, news that New York's governor has issued something very similar, tightening workplace restrictions as well. Now ordering non-essential businesses to close and that public transportation only be used for an emergency. The governor also calling ventilators what missiles were to World War II, and what the health commissioner revealed in New York today. The demand for testing tonight, the National Guard arriving before dawn to help set up one of New Jersey's first drive-through testing sites. And within hours, police were turning families away. Tonight, right here, the new data about who is most at risk, the warning from the World Health Organization for younger people, and the difference between men and women and what could be driving that. We'll guide you through it all on a Friday night, and we're going to begin here with ABC's Chief National Affairs Correspondent, Tom Llamas.
Tonight, a new phase in the war on the coronavirus, and it starts at home.
This is the most drastic action we can take.
The governor of New York joining California, issuing new mandates. Beginning Sunday, all non-essential workers ordered to stay home, even limiting New Yorkers from using public transportation unless it's urgent and absolutely necessary. Non-stop New York quickly slowing down. This is Grand Central normally.
But take a look at today. Near rush hour, when Grand Central should be packed with people, it's nearly empty.
The goal of the ramped-up measures is simple: stop the spread of the virus. With more than 8,500 infected, the cases in New York are the highest in the nation. The governor says the high number due to more testing, with 10,000 tests conducted in New York State alone overnight. Governor Cuomo asking businesses to help with the shortage of crucial medical equipment, offering to pay a premium.
Ventilators are to this war what missiles were to World War II.
Today, President Trump calling this battle against the virus a war, announcing he's enacted the Korean War-era Defense Production Act, asking American companies that can, including automakers, to now manufacture masks, gowns, gloves, and ventilators.
So we're invoking it to use the powers of the federal government to help the states get things that they need, like the masks, like the ventilators.
Can you name any of the companies that you've asked to start making these ventilators or face masks?
I will be, but first I want to get the approval from the company because I don't want to be doing that.
Okay, well,
I assume they'd like it, one
did
of the
the
companies, but
government
I
ask
didn't.
General Motors to
I
do
didn't
that?
speak to them about announcing it, but I'll announce it. I'm sure they wouldn't be, but we have others also.
Health officials here in this country alarmed at some of the figures coming in from around the globe, especially Italy.
From Italy, we're seeing another concerning trend that the mortality in males seems to be twice in every age group of females.
Tonight, President Trump still insisting he is not considering implementing stay-at-home measures nationwide. This morning, almost 40 million Californians waking up to a new normal.
We direct a statewide order for people to stay at home.
Residents allowed out for essential trips only, including the grocery store and the pharmacy for medicine. Governor Newsom predicting if the virus is not contained, 56% of the state's population, more than 25 million people, will have the virus in the next 8 weeks. Already you can see signs of the virtual lockdown. The famed Santa Monica Pier deserted. And tonight, more states are joining the effort, like Nevada and Illinois.
I fully recognize that in some cases, I am choosing between saving people's lives and saving people's livelihoods.
Now that California is on basically lockdown, now we're really trying to limit our activities.
And tonight we're hearing from so many Americans across the country about how this crisis is affecting their families.
I am very nervous, just feeling like, when is this all going to end?
How hard is it right now?
It's extremely hard, and we're assuming it'll get harder. I mean, we were even debating, should we come out to the park? We feel guilty coming out to the park right now, but we thought good weather, maybe this last opportunity to come in. Kids are going crazy. Let's try.
For one New Jersey family, the virus is taking an unimaginable toll. 4 members of the tight-knit Fusco family dying within days of each other, some still hospitalized.
The second we start to grieve about one, the phone rings and there is another person gone, taken from us forever.
Just incredible what that family in New Jersey has gone through, and luckily that's been a rare case, and I know there are prayers coming in from all over the country for them. We're with Tom Llamas now. He's live in New York. And Tom, after the restrictions in California, we know the restrictions here in New York officially take effect Sunday evening, and the health commissioner acknowledged something else today that got our attention, that they have already begun to use their crucial stockpile, and we're still early in this fight.
That's exactly right, David. Commissioner Howard Zucker, the health commissioner here in the state of New York, acknowledged that they have already dipped into that stockpile. They're going to hand out those medical supplies to hospitals across the state, and they hope to resupply them. And David, just before we came on, another grim headline that nobody wants to hear that lives here in New York. New York City, according to Mayor Bill de Blasio, is now the epicenter of the crisis in the United States of America. 1/3 of all coronavirus cases are right here in New York City. David?
All right, Tom Llamas tonight. Tom, we'll see you here this weekend. What the health commissioner said here in New York being echoed across this country tonight. Some hospitals already on the brink. Doctors putting masks in Ziploc bags so that they can use the same mask for up to a week. There are urgent pleas tonight from the front lines, and ABC's chief national correspondent Matt Gutman on that part of the story.
Tonight, cascading shortages reported at hospitals around the country. One of the most critical, blood.
Right now, we're at like a critical shortage of blood, again, common across the country, because no one is donating blood.
Clinicians telling us those N95 masks are so precious, they're now kept in Ziplocs or paper bags because they're told to hold on to them for up to a week.
My mask snapped while I was trying to take it off in between patients, and I had to staple it back.
But perhaps the most alarming shortage, doctors and nurses themselves, including Dr. Dara Cass, who tested positive.
I was using all the protection I was supposed to. I probably just wiped the surface with my hands and then wiped my face between mask usage.
She's working from home now, urging other medical professionals to get tested. 2 Navy medical ships deploying, one on each coast to ease the burden. The USNS Mercy heading up the west coast next week, where a battle is brewing whether it will dock in LA or in Seattle. And the USNS Comfort will head to New York in early April. And the Army Corps of Engineers preparing to possibly convert the Javits Center in New York into makeshift medical centers out of fear that beds will run out in weeks. Tonight, we're taking you inside the Ochsner Medical Center in New Orleans, now using special respirator masks to protect staff. And across the country, thousands rushing to get tested. At New Jersey's first major drive-through testing site, police had to turn people away after just 4 hours. One of the nation's leading infectious disease doctors admitting the U.S. is not meeting the demand.
We are not there yet.
Tonight, the World Health Organization warning young people they're not invincible. The CDC says nearly 40% of the people hospitalized in the U.S. are between the ages of 20 and 54. And 22-year-old Los Angeles resident Beyonda Haliti taking to social media to describe how her symptoms evolved. Tonight, she says she's proof that the pandemic can impact anyone.
I just want to let everyone know that, it's very important to stay inside and follow the CDC guidelines and, take this seriously.
And just anecdotally, we're learning tonight, Matt, that there are many young people in ICUs around this country. We have to take this seriously and not have a false sense of security. And Matt, I also know there's news coming in from some sources in Washington State tonight, and really across the country and other places as well, that have echoed what we had heard early on in Italy, that at least in Washington State, they're also now making emergency plans to decide who will get treated in a worst-case scenario and who won't.
That's right, David, and that is because they are running short on supplies and they expect the number of patients to skyrocket. So in the coming weeks, they expect to have to make this brutal triage decision, essentially deciding whether or not to give the sickest patients full medical care. And doctors are telling me they're going to have to make a decision of life and death on the spot. David.
All right, Matt, thank you. And I mentioned Italy just there. Overseas, the numbers from Italy tonight only worsening. In fact, this was the number today, 627 people dying in just the past 24 hours, the worst yet. So tonight here, we're going to take you inside the hospital at the epicenter of their outbreak. We warn you it's difficult, but it's also a warning for what doctors on the front lines could soon face here. Maggie Rulli from London tonight.
Tonight, a glimpse inside a nightmare. A race to save lives in the Italian hospital at the epicenter of the deadliest coronavirus outbreak in the world. And this is just the emergency ward, not the intensive care unit. The ICU is already overwhelmed. Those plastic bubble helmets are connected to ventilators to help the gasping patients breathe. This hospital is one of the most advanced in Europe, but the victims are everywhere, on gurneys, in waiting rooms, in hallways.
It's a very severe pneumonia. Every day, 50 to 60 patients who come to our emergency department with pneumonia.
They say they want the rest of the world to know that this is what's waiting for them if nations don't lock down.
I never felt so stressed in my life. We are doing our best, but maybe it's not enough.
Thousands of volunteer student doctors in Italy are being rushed to the region. And an American relief group has airlifted a field hospital. But there are fears it will not be nearly enough. And Italy's nightmare is now being shared by Spain. Deaths there soaring by 30% overnight, 199 fatalities in 24 hours, over 1,000 total deaths.
Reports out of Italy tonight show that more than 70% of the deaths there are in men. But David, experts say they're still mystified as to why this virus seems to be hitting men harder than women. David?
We're going to drill down on that, men versus women, with Dr. Jen in just a moment. Maggie, thank you for that. There is also breaking news coming in tonight from the White House that a member of the vice president's office has now tested positive for coronavirus, what we're learning on that front. And President Trump and his words today about a drug that he said could be a game changer in the fight against coronavirus. But then moments later, the nation's top doctor on infectious diseases, Dr. Anthony Fauci, was asked about it and offered a reality check. Here's our senior White House correspondent, Cecilia Vega.
24 hours after President Trump declared a malaria drug would be made available almost immediately to help treat coronavirus, Dr. Anthony Fauci declared the drug has not actually been proven to help.
Is there any evidence to suggest that, as with malaria, it might be used as a prophylaxis against COVID-19?
No, the answer is no. And the evidence that you're talking about, John, is anecdotal evidence.
But President Trump pushed on, leading to a rare public rebuke by the nation's foremost expert on infectious diseases.
May work, may not work. I feel good about it. That's all it is, just a feeling. I'm a smart guy. You know the expression, what the hell do you have to lose? So I've been right a lot. Let's see what happens.
I would like Dr. Fauci, if you don't mind, to follow up on what the president is saying. Should Americans have hope in this drug right now?
The president feels optimistic about something, his feeling about it. It might be effective, but as a scientist, as we're getting it out there, we need to do it in a way as while we're making it available for people who might want the hope that it might work, you're also collecting data that will ultimately show that it is truly effective and safe under the conditions of COVID-19. Fundamentally, I think it probably is going to be safe. But I like to prove things first.
We'll have more on that, of course, in the days to come. Cecilia, in the meantime, what have you heard about a member of the vice president's office tonight?
David, this is just coming in from his office right now. They say a member of his team has tested positive for the coronavirus. Neither the president, they say, nor the vice president had close contact with this person who's not being identified. But the vice president's office is saying that they are now going back to see exactly who this person had contact with here, David.
Again, a member of Vice President Mike Pence's office tonight testing positive. Cecilia Vega with the breaking news. Cecilia, thank you. And this evening, at least 2 senators are under fire for selling stock before the coronavirus pandemic. And at least one of them and their private words. Here's Mary Bruce.
As the Dow continued to plunge today, serious questions about whether senators have been using insider information on Capitol Hill to pull their own money out of the stock market. Last month, Republican Senator Richard Burr assured Americans the United States today is better prepared than ever before. A week later, Congress received a closed-door briefing on the impact of the virus. The very next day, Burr sold off up to $1.7 million in stock, including investments in the hotel and travel industries. As the situation grew worse weeks later at a private event, Burr shared a more dire warning in this audio obtained by NPR.
It is much more aggressive in its transmission than anything that we have seen in recent history.
Today, Burr said he relied solely on public news reports to guide his decisions. Understanding how it might appear, he's now calling for the Senate Ethics Committee to investigate. On the same day she was briefed on the virus, Republican Senator Kelly Loeffler also sold more than $1 million in holdings. The Georgia senator, whose husband is the chair of the New York Stock Exchange, insists their investment decisions are made by third-party advisors without their knowledge.
I've seen some of those stories, and it's absolutely false, and it could not be true. I'm not involved in the decisions around buying and selling.
Now, there are also questions here tonight about Republican Senator Jim Inhofe and Democrat Dianne Feinstein, both of whom have recently sold off hundreds of thousands of dollars in stock. But they both say they were not at that coronavirus briefing and insist they were not directly involved in the